Let's get going. Hi everybody. Welcome to Empowering the Individual and Developing a Sense of Agency, the second webinar in our Black History Month series. Woohoo! I am so excited to have Karen Peterson here to talk about the importance of health literacy and how clinical trial participation can be life-saving. Like the previous webinar, I'd like to start us off with a quick fact about minorities in healthcare, this time focusing on diversity in research. So, an estimated 15.3% of Black children have asthma compared to 7.1% of white children. In 2017, the National Heart, Lung, and Blood Institute conducted a whole genome sequencing study of minority children and found that albuterol, the first line of therapy for lots of kids and adults with asthma, is 67% less effective for Puerto Rican Americans and 47% less effective for African Americans due to an African ancestry genetic difference not studied in initial asthma research. So this is a fact that I chose because my sister actually has asthma, and I remember watching her lots and lots of times go through these long breathing treatments, and my mom being super worried about her and just, trying to understand this diagnosis. And I know if my mom had known at the beginning that maybe albuterol wouldn't have been what it isn't as effective for young Black children as it is for white children, then maybe that treatment would have been different. So that's why it is just super important to have diversity in research, and why I'm super excited to have Karen here to talk about her experience with that, and just understanding a better way of conducting research. So I am going to now pass it on to Karen. Karen, thank you so much for being here. Would you mind telling us a little bit about you?
Thank you so much, Ariel, for the introduction, and thank you to Savvy Co-op for partnering with Karen's Club to present this night's webinar. My name is Karen Peterson. I'm from Harlem, New York City. That's where I currently live. I'm a single mom of one. I am the co-founder and chief patient advocate of Karen's Club, a grassroots organization that supports and empowers and educates patients of color around all things clinical trials. Because a clinical trial saved my life back in 2017 when I was unfortunately diagnosed with stage 4 triple negative breast cancer. It's an aggressive form. I think it is the most aggressive form of breast cancer there is, and it definitely affects the African American, the Black and brown community more than it does other communities. And it was rough. And luckily for me, I was able to claw my way through, self-advocate, self-educate, and make it into a clinical trial, and my life was saved. And I've been in remission now for about, it is my 6th year. So again, I think the American Cancer Society says that only 12% of people with metastatic triple negative breast cancer make it to the 5-year mark. So it's a huge accomplishment, and having Karen's Club helps me pay it forward to patients, and helping them understand what their issues may be in regards to accessing quality health care and understanding the value of clinical research.
Yeah, no, thank you and congratulations. Yes, like Mike said, about on your 6th year, that is amazing. And I think that it is just so wonderful. You are just such an inspiration to me, being a young Black woman, out here in New York City too, trying to figure things out. And so I'm super excited to be here speaking with you. I'll move on to our next question, which is, tell us about your organization and how did you get involved with Karen's Club?
Thank you for asking that question. So the organization is it's like my baby. And it's so important because, again, there's a lot of skepticism and a lot of what is going on with clinical research? I'm really not understanding, especially in the African American community, because of our history. And so, of course, my life was saved because of the clinical trial. And so with Karen's Club, we have these wonderful one-on-one consultations that patients can get for free. They can just sign up and get an hour or more with me. And it can be 1 day, 2 days, 3 days. It's no limit to the consultations. And it's really important to get there and get in there with patients and figure out what it is that they're interested in regards to their health journey. What steps do they need to take? What actions do they need to take? And help them build this plan and do it in a way that doesn't seem really, I'm going to say, sciencey, for lack of a better word, because again, you don't have a science background, it can be really overwhelming. So I have this wonderful way of being able to translate those really complicated science based hypotheses into metaphors that make sense and that patients go, oh,
Hmm.
can see. Because again, if you're able to understand something, you're more than likely to open your mind up to being able to say, okay, I might want to think about doing something like that. So it's really important to
Hmm.
health literacy is huge with that. And I didn't think, Karen Co would be doing that, but we spent a lot of time doing that. In addition to that, we also provide these wonderful webinars, educational webinars, where we provide opportunities for providers to come in. I bring them in, and they're there to talk about the science as it is, as it was, and is, and what they're doing about clinical research and how they're trying to save lives, and just talk about the work that they actually do and how important and vital it is to have all people, everyone participate in clinical research and what the value of that is, and to break it down in like really simple terms. I warn them before they come
Hmm.
are like, don't come in here talking, very bookish and clinical, because people, they like, oh man, I don't understand this, or they just sort of like zone out. Nobody wants to pay attention. And so it's important for people to feel, especially if they've never been had I could say exposure to a clinical researcher, to have someone in front of you who respects your voice and who understands that not everybody in the audience, has a PhD in science.
Yes, yes, no, absolutely. Something that's always stuck with me that from our first meeting is that you want to be the third person's call when they get a new diagnosis. Call your family, call your doctor, and then call me. That was something that you said to me, and I just love that you are such a fierce advocate for people. And I think that having someone like you in their corner who has some more experience in how to handle this and how to handle those big words is super super important. um yeah, yeah, no, I think that that was just awesome. I wanted to bring it up. So next question that I had is, what are some key needs for someone affected by cancer and other treatment areas that you have who come in to Karen's Club, and how do you see these needs affected or amplified but within communities of color in particular?
So let me take a stab at the first question. What are some of the key needs for somebody affected by cancer? And I think everything. Like, it's not just one thing. Like, there's really no guidebook. There's nothing that really can prepare you for a cancer diagnosis. You can be, your whole life can literally change in seconds when you get that diagnosis. So everything from, I can remember once, supervisor, when my last job before I got fired like 4 weeks away from FMLA protection. I was just 4 weeks away. I'd been on the job as a social worker for 11 months, and I got diagnosed and I didn't have the protection. I had to go out on treatment. But my supervisor at the time said to me, Karen, she had a friend who had been going through treatment. And she said to me, you're going to have to build a team. And it was really important. And so when you think about a team, most people just think about your oncologist and your doctor, and that's it. And maybe a friend. But no, there's so much more. Mental health. There's so many people really, it's left on the back burner. It's really, really important. And when I think about the fact that social supports are really important in regards to being able to pay your bills and being able to have, a caregiver and have support for them to be able to, have childcare, set up to make sure that, your children are going to be okay while you may be in treatment. It's just making sure that you have the right insurance coverage. And we'll talk about that later, because I've got some resources, especially for the people in New York State. Shout out to New York. And it's just, there's just everything. So I can't really say there's just one special thing that, someone would need. I would think across the gamut, there are so many different things. And having access to the tools that help make and informed decisions, those are key.
Right.
And those are really important.
Yeah, I think, access is something that is super, super important for care. And I know that that's not the case with, just working with Savvy. We try to reach people in lots of different areas. And, we often focus on people who may be in rural areas who might not have access to care all the time. So that is like you said, just something that's super, super important, and finding the resources or people in your area, or at least a support team that can help you try to find those folks, I think is important. So yes, thank you for touching on that. And then to the second part of the question about communities of color, how do you see those needs amplified or change?
So I feel like that's a really good question because again, we're in 2023 and we all know what happened in 2020 with COVID-19 taking place, the pandemic sweeping across the country. And it was like snatching the covers off or snatching the blinds back on a conversation about healthcare in the African American community that we talk about all the time, but no one else really maybe paid attention to, right? And so when COVID-19 happened, it was just like, oh, this disparities became very apparent in regards to the vaccine and access to it, and why we were really skeptical about taking the vaccine and where this skepticism came from. And all of a sudden, the questions and the conversation started to arise. So when we think about amplification, we think about there are so many opportunities that have come from that, the DEI, diversity, equity, and inclusion, because of the pandemic. And, how fortunate we are to have, members of the community now in positions where they weren't before, having, conversations with pharmaceutical companies and teaching institutions about what needs to be done in regards to change. And those conversations went on really hard in 2020, 2021, and in 2022. It was still happening, but they were like sort of like gathering themselves. And I mean the gathering, the ecosystem itself, meaning the insurance companies, pharmaceutical companies, nonprofits, to sort of really think about the initiatives that have to take place. Because again, advocates aren't going quietly into the night anymore. Those days are over with. We are loud and proud. And it's like, no, 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 we are not going to accept substandard care as standard care. So the amplification came, and it came hard, and it's still happening. But I believe that everyone who was a part of the ecosystem had to sit up straight and take accountability for their part in the process, in the institutional system that was in play, and what needs to be done about that. And then this wonderful thing, when I think about, well, what's actually happening, in December of 2022, President Biden signed into law the Consolidated Appropriations Act. And in that, the FDA has a sort of portion of this bill. And it's really important to highlight that the Food and Drug Administration includes several provisions intended to promote diversity in clinical enrollment, encourage the growth of decentralized trials, and streamline clinical trials. And this is unprecedented because, again, it is accountability. People have to be accountable.
Mm-hmm.
And that's,
Right.
very important. So now it's like, okay, because of that, there are so many different initiatives that we can talk about in a moment that are happening that
Mm-hmm.
and came out of these conversations because of COVID-19. So the amplification and change is rapid, and it's happening. And again, patient advocates
Mm-hmm.
across the country are going hard, and I'm loving it. I'm loving being a part of the process.
Yeah, yeah. I feel like in before 2020, and kind of even in 2020, it was trendy to be diverse and to have, that buzzword as a part of your mission statement or whatever. But now I feel like because of what happened, it was a catalyst for things to actually change, because we, on a public scale, we all saw like this is wrong, like there's so much wrong with how we just go about life in this country, and how there are so many people who get left behind because they're not a part of conversations. And so it is really, really important now. And I think what your organization is doing is awesome, and what Savvy's organization does is amazing. But just in general, like, I think that we're moving into a new space, and it does feel hopeful. I feel like a lot of us, I know me sometimes, like I kind of am cautiously optimistic for things because of just things that have happened in the past historically. But I do feel like we are moving in a new direction that is really good, and I'm hopeful about that.
I'm glad you're hopeful. It's important to have hope because sometimes we can get in our own way with the skepticism, and that will shut us off from the opportunities. And I'm a
Right.
perfect example of that. You think about it. I survived a phase 1 clinical trial, Black woman, and I hadn't met anyone else who had gone into a clinical trial. My original team did me dirty, for lack of a better word, and I had to go out and seek a new team and get access to those tools. And I really had to suppress those emotions and make sure I was making really
Mhm.
solid decisions based off science. And so, again, I understand the skepticism, but hope is really important because, again, that fear and skepticism will keep you, away and getting your own way of making, or even just looking at an opportunity and embracing it and thinking about it.
Right, right. That's not to say to not research it for yourself and make sure that you're not putting yourself in a space of danger, but at the same time, it is particularly important. And I keep saying important, but it is important to just take a risk sometimes and understand that that risk could lead to a massive reward, as it has for Karen. So, and like I said at the beginning, we want to make sure that we're included in these trials and our voices are a part of these things so that the products actually serve us. And, albuterol starts to actually serve African American and people with African ancestry. It serves our identities because we're involved in the conversation from the beginning. So, yes.
I definitely feel you on that. And I feel like when you talk about risk, when I talk about the clinical trials and clinical research as a whole, I'm a skeptic, right? Most people don't know this, but I believe in taking calculated risks. So having access to the tools, to make an informed decision, to be able to say, okay, this would be the right decision to make, or this is the right option, or this is maybe the decision, the way, the direction I should be going based off science. Because I didn't roll over and go, today's the day I'm going to go and try a clinical trial. It was a lot of methodical research that had to go into it and really solid base foundations, reports that indicated that this was the right way to go. So I definitely, I'll drop our takeaways during this conversation, but for people who have been diagnosed with a chronic disease, or especially people who've been diagnosed with advanced cancer, make sure you get those diagnosed tests, especially genomic testing, biomarker testing, because then again, you're making science-based decisions, especially in regards to clinical trials, and you're not just going out there. I know it's a roll of the dice, but like I say, I like calculation, and I think it's really important to put your best, foot forward. Yeah.
Right, right. Exactly. Exactly. Going on to our next question, and I think that this is in line with kind of speaking more toward health literacy, but what are some ways that you work to empower the people that you connect with?
I think I really take pride in making people feel comfortable and hopeful because, again, when they arrive and we're, in the space where they're willing to have a conversation in the consultation, you know, most are overwhelmed, most are confused, most are dissatisfied with, something that may have happened in regards to the medical journey. Some may be fearful, but in general, 99% of the time, I say 100% of the time, people really want access to quality healthcare, and how you're able to do that. So I really try to meet people where they're at. And I know that, people use that term all the time, but I'm really, really into that because I feel like before we can even have a conversation about science or about, tools and diagnostic things that can get you to where you need to be, and second opinions and clinical trials and research, we have to figure really out, like, how are you feeling? How are you doing? What is it that you want to accomplish? Is it a second opinion? Do you want to lengthen your life? Do you want, hospice care? Like, we really have to figure that out. You have to be respectful. And so I, as a patient advocate, especially, like I said, again, making informed decisions, it's really important to help patients feel comfortable about speaking to somebody who's already been through the process and know what it's like to feel like their voices have not been heard or they're confused about something, and really taking the time to help people, like clear out the clutter and become really organized in their thinking and think critically about the steps that need to happen. So I love it when, people at the end of the conversation, a patient or caregiver may go, "Oh, I understand now. Ah, I hadn't thought about that." Those words really make me happy because, again, now they're thinking about something that, like I understand what's happening now. It is really difficult to try and get through a cancer journey and make decisions under a pressurized environment and you don't understand what's going on. So before anything is really getting in, with people and really huddling and trying to figure out how they're feeling, what their goals are. And again, it's really about them. It has nothing to do with me. Yeah, I may use, my story just as an introduction, but it's really all about building their confidence and really building out an action plan and moving forward so that they can, get access to the care they need. In addition to that, when we talk about what I do to empower patients on the back end, I'm always involved with researchers. So I'm very privileged and lucky that I have a lot of access to researchers, clinical researchers around the country, and they're constantly trying to figure out, take from my brain, what can they do to sort of like bridge the gap with their patients, get more Black and brown people into clinical trials, about their products that they may be offering in regards to diagnostic testing. And so I love being able to give them real hard, concrete feedback, whether it's a researcher at a nonprofit who's trying to get a message across for, like, say, Black History Month, and they really want to know, like, what more can they be doing? And so I usually bring those messages. Like, I'm the messenger, literally. I carry these messages with me, and I talk to them about the stuff that patients are telling me in regards to feeling maybe devalued or not understanding or feeling like something wasn't offered or feeling like they dealing with medical bias or feeling like, when I hear from patients and they say, well, wow, Karen, how did you stay alive? And I tell them about, my experience in the clinical trial. And it was, I had the carte blanche, like a really Rolls Royce situation. And I hear from patients saying, well, I've enrolled in the trial. I don't have, valet service. I don't have, lunch, reimbursed. I don't have a masseuse. I don't have a nutrition. I was just in the clinic the other day with a patient and in the clinic, and they were talking about not feeling really well, and they were talking about their diet. And immediately I said, "Oh, did you make an appointment with a nutritionist?" And it was just like, "Oh, I hadn't really thought about that." But I can remember being on the trial, and the first day I was there, the nutritionists introduced themselves to me, making sure that these researchers understand that it's not just about the drugs, and it's not just about, getting these numbers on paper and feeling really good about yourself. In order for us to participate in trials, we need your support. And the support can be from designing trials that make real sense. So bringing those messages from the patients to the researchers and relaying them in real time is really, really important. So when patients think that I'm doing something else, I'm out there, knocking on doors and having conversations with people who are in places to make decisions and determine how things will go moving forward.
Right, right. I love that. And something that stuck with me in that was understanding. And I think that that goes back to the title of this is developing a sense of agency. When you understand, like, what it is that you're going through, and you understand what questions to ask, you feel like you have a sense of like, okay, I got this. I know how to go forward in my care. And so I love that you are doing that work not only with patients face to face, but also with the researchers and with the people who are conducting these trials. So yes, I want to read what Nina says here. She says that having access to certain amenities would make the clinical trial experience so much more pleasant, helpful, easy, and etc. for patients. And totally agree. It's all about being patient-centered and human-centered in what we do.
Totally agree with that comment, and I appreciate that. Thank you.
Awesome. So next I've got, what are your thoughts on our current medical system?
This is a loaded question.
Yeah, I know it is.
Oh my goodness. So, like, I was watching, like, the news yesterday on CBS 2 New York, and There was a woman, African American woman, and she was talking about the fact that she needed a kidney transplant. And then it was revealed that for African American patients, it can be up to 64 months for a kidney transplant versus 37 months for a white patient. And I was just like, what is going on? I sat up on the sofa. And then they talked about how that there is a test that determines kidney function in African Americans that has been wrong all this time, that has put years on us waiting for this kidney transplant. And so now they're telling, patients that they're going to get an email indicating that years will be put back on, or so their wait will be shortened. And it's just like, when you think about this, or you think about the New York Times article that came out, like, I think it was like maybe this week, talking about the maternal crisis out there in California, and the fact that, Black women are more likely to die, even if you are rich and you have insurance coverage, more likely to die than a white woman. It's disturbing. When you think about the thoughts on the current medical system, it's, I have hope in one sense. Again, like you said, we talked about hopeful, and that there are sometimes when I hear stories like this, right? Because, like, again, it's a Kellogg Foundation research article that came out. Anybody can Google it in regards to maternal health and the crisis out there in California. Whoa, it's like, oh, come on. Like, we should all feel confident and feel, like, we have access and options, and we shouldn't, be subject to substandard care just because we are of a certain color. So I have my moments where I'm a little angry, and I get a little like frustrated. But so now I think about, sometimes, is it a situation between the haves and the have-nots? Is it really about that? And I know there's lots of work that needs to be done by different parties. You think about the insurance companies, and how, again, biomarker testing was one of the things that saved my life, because it gave me the options. It clearly indicated that, I was going to be a good candidate for immunotherapy, a clinical trial with immunotherapy that saved my life. But not everybody has access to it, because it's a very expensive test, and it's just a diagnostic test, just like a CT scan, just like an X-ray, just like an MRI, right? Insurance pay for that. But for whatever reason, some insurance companies aren't paying for it. In addition to that, some states aren't even mandating that it be covered. And most doctors feel that people with advanced cancer, like, that should be like one of the very first tests you have. So there's a lot of work that needs to be done. And, we can talk about the best practices and some things that I know about that are happening, but yeah, what are my thoughts? Yeah, a lot of work still needs to be done. I'll just leave it at that.
Agreed. I mean, you touched on it, but having a different test for African Americans to receive a kidney versus white Americans, and there's the whole, thought about African American women feeling pain in a different way, which is a lot of where gynecology practices come from too. And so it's just like there's all of this baggage and all of this history that is involved with how the medical system was formed and how it interacts with different communities. So yeah, I agree. We've got a long way to go, a long way to go. But there are people here like you who are doing really wonderful work and trying to get things going in the right direction. And so, like I said, that definitely gives me hope. I'll read what Mike here says. He says, we systematically still blame, especially patients of color or people of color, patients for their conditions. Insurance structure shows us just that we still blame the person for having that condition rather than the system. So yeah, I totally agree there.
Yeah, I appreciate that comment. I definitely feel that. Yeah.
Mm-hmm. Okay. So next I've got, why do you think participating in clinical trials is important?
Why do I think? So there's a couple of reasons. I think number one, we'll just start off with efficacy. Like, does the drug really work? Or do we know whether or not the drug really works, especially in different communities, right? So, across the board, most clinical trials are made up of white males, right? And so biologically, I'm not a scientist, but I'm assuming there are some differences. in the African American community biologically. And so without us participating, do we really know whether or not the drug is really gonna work? Hmm. Right, but it's put on the market. So that's number one. In addition to that, well, this could be number one, but it's number two, the missed opportunities. So I'm going to give you two examples of that. I'll give you my example of my life, right? And then I'll give you something that happened last summer. And it was like, whoa. So, of course, with myself, I was in a phase 1 trial. It was immunotherapy only. And I think I was like I was the first triple negative breast cancer patient in the nation on a trial. There were 35 of us. There were 5 responders, and I was the only complete responder. And this is 2017, right? There was no FDA approval other than chemotherapy for triple negative breast cancer. I had a 4% chance of survival, right? Here I am today. That drug, one of the drugs that I was on, they discontinued the production of this drug last summer. So when people say, well, how did you do it? It's you can't even go and knock on that door anymore. So the windows of opportunity sometimes when people think they have time to do something, the oxymoron is they want the healthiest of the sick, meaning the researchers really want the healthiest of the sick. And I know that sounds like, oh, what? But it's the truth. And sometimes those windows of opportunities, when you think you have time, you really don't. And I've heard from numerous people, whether they be researchers, whether they be executives, always ask me, Karen, how did you know to do what you did when you did? And I was just common sense. Like, the standard of care wasn't working for me. Why not think about it and think about it critically and make sure that I have a science-based, foundation in order to make this decision. And so missed opportunities is huge. And so again, the second story is this last summer, there were 19 patients that it was announced. I think they were over at Memorial Sloan Kettering. They were all diagnosed, I think, with advanced, non-operable, I think it was colorectal cancer. And they had a specific mutation and it made the news. And it was like, whoa, because all of them were in the clinical trial and all of them went into remission. And so again, the trial was really small. And sometimes people think like there are, thousands of people diving into these trials or the doors just swing open. And a lot of times for a phase 1 trial where you're guaranteed the drug and it's not randomized like in a phase 3. Those opportunities aren't always there. You think, I've been in the room. I have been in the room with patients prior to COVID as an advocate before Karen's Club with patients who have been treated and been treated and been treated and who are now, circling back to me, wanting to think about clinical research. And, we got them there, we got them to the doctor and they've been orally treated. They weren't in the percentage that the doctor felt they could survive a clinical trial. So there are a lot of things and factors and exclusionary criteria that you have to really think about. So these are the reasons why I think participating in clinical trials is important, because science is moving forward. It's moving forward every day. And I don't want my community to be left behind. I don't want to continue these opportunities.
Right. Exactly. And now we move forward to what are your thoughts on health literacy? And I want to make sure that the audience knows that I have a question here in the chat or in the Q&A about how you all define health literacy too. So feel free to answer that and we'll kind of go back and forth in conversation here. But Karen, I'd love to hear from you first before we hear from the audience.
What are my thoughts on health literacy? It's very simple, really simple. It's essential. That's it, bottom line. For some of us, it may be easy, and I understand that. And so again, I'm very mindful to that. And I'm very I handle people with kid gloves when it comes to health literacy, because again, it's one thing to be healthy and try and figure something out. But when you're ill, right, and the emotions are raging and you don't know what is happening, you're trying to make a decision in a pressurized environment, health literacy, it is not easy. Again, I was in the clinic the other day and I was talking to a patient, and the patient was listening to me, and she looked at me and she says, I'm glad, you are as astute at medical research, but I don't want to be to do that. I don't want to have to do that. And it was real. it was honest. And I appreciated that because not everybody's built, not everybody wants to. You're trying to stay alive. And so I think health literacy is important for the patient because it empowers you. But at the same time, if the patient really is incapable or does not want to, or that's not their focus, then there should be alternate ways to be able to get them the information that they need. And by that, it could be just really doctors, nurse navigators, social workers, the community, making sure that the patient is equipped with this information as they move along their journey in every entry point and every touch point with whatever provider that they're with. So the long story short, it's essential. I'll just put it like that.
Hmm. Yes, no, completely agree. And then the second part to that question is how can someone become more health literate, sorry. And what are those kind of first steps to take in learning how to do that?
I think it's how somebody can become health literate. It's pretty easy. Well, okay, excuse me. Here's the thing. You just start really with your local support group. And it could be just a support group or it could be disease specific. So for me, I can remember in my early stage when I was diagnosed stage 1, I was really into going to the support group. So there's tons of support groups, in your local community. They're at your hospital or they're online. And we can talk about that later on when I will share like some of the different organizations. Oh, I have them here actually written down. Attend a local health fair. So I think that's a great way. You see them all the time, whether they're online or in your local community. They oftentimes happen in the summertime, in the springtime, and sometimes we pass by them and we're like, oh, we keep going, we keep it pushing. And it's like sometimes you might want to just spend a few moments picking up a brochure about prostate cancer, picking up a brochure about breast cancer, picking up some information on lung disease and all these things is really, really important. And in addition to that, depending on the interest, start chatting with those organizations and attend their educational programming. So again, there are so many organizations out there like CRI for immunotherapy, Leukemia and Lymphoma Society for blood cancers, young persons diagnosed with cancer. They have the Young Survivors Coalition. Black breast cancer has Touch BBCA. The Black Health Matters. The Pink Foundation, ANCAN for prostate cancer, SHARE has wonderful support groups. Even have a Latino support group online, really big and strong online. And of course, Karen's Club. There's lots of organizations. So I feel like the opportunities are there, whether they're in person and locally or online or, again, in those, intimate, support group scenarios, but there are ways to do it.
Yes, totally agree. I'd like to read this comment in our chat section. Dorcas says, and I'm sorry if I mispronounced that, says, I agree with you 100%. I am a clinical trial statistician. Sorry about
Say
that.
that 10 times.
And it's a bit of a mouthful for me. And I understand that Black people are sometimes hesitant to join clinical trials, but there is also limited and little to no resources allocated to research for these groups. I believe awareness and sharing some of these opportunities to people is very much needed. We need the participation because, rightfully so, a lot of the medication out there, especially diseases that have a genetic component like cancers, may not work for us. Empowering patients with information and opportunities for such research is essential, as we also advocate for funds and other factors needed to facilitate this research.
Here. I love that. And I love the fact that it came from a provider, I believe, and the fact that she used it empowering because, again, it really is when I remember what it was like. I've been in a situation where I did not understand my pathology report. And let me tell you, I would not be here if I had not become really educated about my disease and really started reaching out to those researchers who were actually doing the work. And they took it from there. Like, oh, you want to make an informed decision? This is how you do it. So finding those educators and getting that information, like I said, it can be overwhelming, but there are so many different opportunities to do it in large ways or very intimate and small ways with those organizations who have those lay navigators, those patient navigators, those clinical trial navigators, those social workers, even sometimes the churches will have like those healthcare summits and just any touch point that you can have where it's non-intimidating. Because I know sometimes, somebody will start talking to you and it's like, you just zone out. It's like, what? But if you're able to get, consistent, opportunities to be able to, have interaction with a healthcare provider in a setting where it's not, clinical, or in a setting where it's just you're in a community, you're more likely to feel like you can ask a question and don't feel like, you're being, talked down to, or you don't understand what's going on.
Mhm. Absolutely, yes. I will ask you one more question before we open it up to a general question and answer session from our audience. So, the last question I'd like to ask, if there's one thing that people could take away from this webinar, what would you want it to be? And also, how can people find you?
It's not just one thing, it's several.
I know, lots of things, right?
I would say if you've been diagnosed with cancer and can't afford care, especially in the New York City and the New York State area, I have this wonderful program called the Medicaid Cancer Treatment Program. And so if you've been diagnosed with like prostate, colorectal, cervical, or breast cancer, and you don't have insurance, or you're underinsured, or you've been laid off, and thinking about trying to find insurance, this is a great way, because they cover patients in New York City who currently need care. So it's called the Medicaid Cancer Treatment Program in New York State. So for other patients or other caregivers who are on this webinar who don't live in New York, just think about, critically about where you can get your care covered, because it's really, really important. And also think really critically about where you're getting treated. Like, you want to stay in your community? That's fine. But is that the best thing? Like, really think about where you're being treated, because it can make the difference between life and death. And don't be afraid to seek a second or third opinion, and find somebody to come along with you when you go on your appointment, so they can record the conversation for you and help you maximize your appointment with the doctor. And make sure you have all of your questions together and you're organized before you go into the doctor. So because it's difficult, again, to absorb the information. So have those questions written down and just go at it. Have those conversations with the doctor and take it, full advantage of the tools, the organizations that are out here that want to help you. Take full advantage of those tools and those navigators and those social workers and those nonprofits that are here, working every day to make sure that the patient experience is better.
Absolutely. I love that. And I'll read a comment from our chat section. Michelle says, it is important to educate yourself, but also use your fear to empower your knowledge. I am currently in a clinical trial, and with the help of Karen, did my research and found the right trial for me. I also got involved as a consumer reviewer because it is important for POCs to be a part of making this decision.
Hi, Michelle. How are you? Thank you for that shout out. I really appreciate it. Again, I feel like each one teach one. And each time I'm able to help a patient and empower them. And again, Michelle has gone on to empower other patients. That's a testament. It's really a beautiful thing to watch patients blossom and become advocates on their own right. I think she was doing this on her own before she got with Karen's Club. But again, to be able to have those conversations and have somebody to talk to who's actually been through it and take advantage of, free support. It's free. It doesn't cost you anything. So you can go on www.karensclub.org. We got a Facebook page. We got IG. We got LinkedIn. We there. We.
Yes, yes, yes. I love it. We've got a question in the chat from Mike. He says, when it comes to health literacy and meeting people where they are, how are you seeing misinformation on social networks impacting the approachability of good information online?
That's a really good question. It brings me to
Mhm.
mind a woman who I spoke to from California. She was a nurse. She was a breast cancer survivor. She was a mother of two. She was a provider, right? And I was like, so, you're on the West Coast. How did you find me? She said, I did my research. I've been talking to other advocates. And she said she had talked to an advocate, and the woman was like, you just should just sell your home and just take your whole family and move. I think she said to move to Mexico. And I was like, well, why did she say that? And, I won't get into it, but it's like, uh, again, I feel like it's important to find credible information. So when I was out there trying to find information, I compartmentalized it. I went with patient stories, and those vetted patient stories, like the Stephanie Joho and like it's Judy Perkins, the first woman in the world to be cured by metastatic breast cancer, according to the NCI, right? It was important for me to find those stories that had been vetted. It was important for me to go to the American Association of Cancer Research. It was important the Cancer Research Institute, American Cancer Society, Susan G. Komen, Cancer Commons. Like, find those national organizations, ASCO, that really, there are doctors there are, staff there. They have been doing this for quite some time. Again, blackdoctors.org, like, really be careful about the information that you're getting. So I was the type of person, I like the Wall Street Journal, I like the New England Journal of Medicine, Science Times. That's the type of person I was. And I would actually, I know this sounds like a lot, but this was me. I'm telling you my story. I would actually contact the doctors who wrote the different information, who wrote those papers, and who published the research. And that's how I found my second opinion. So again, it's a great point to be mindful, really mindful, and dedicated to making sure that the information you're getting is just not somebody who just woke up and decided to share an opinion. Because opinions are important, but you need medical credibility and someone who's been around quite some time, who has published work, who has experience. And so you can usually find a lot of those doctors through like I said, those solid nonprofits who've been around a while.
Yes, I love that. Super, super, super important to find the people who've been doing it for a minute. And that's not to say that you can't find support online, because you can find support from people who are, going through something. There's plenty of Facebook groups out there, plenty of support groups that are available. But, finding the right information, you got to kind of do a little bit more searching than just on a TikTok or something that you may see.
I agree.
All right. Any other questions from the audience? And I'll say again, thank you all so much for joining us for this conversation. I feel like it is going and has gone very well. So thank you for being here.
Thank you.
All right.
Yes, thank you. We appreciate it.
Yes. We got another question in the chat from Matthew. He says, if you could wave a wand and there was one thing every clinical trial sponsor started doing to make clinical trials welcoming to people or to POC patients, what would it be?
If I could wave a wand, I probably would ask them to spend like at least $1 billion on funding and producing Black researchers, period. It's nothing like
that was $1 billion with a B. Yeah.
Nothing like talking to a doctor from your own community who's been through the life, who understands, what the skepticism and the cultural competency. You don't really have to explain things. We don't have to have these awkward conversations. We don't have to try and make them understand or feel like, we're, not heard. I would want them to definitely fund and invest in researchers of color, especially Black researchers, and do it really early on. I'm talking about make being a researcher in colleges, that field of work, sexy in the like 6th grade, 5th grade, and keep going at it. Because again, I think I know maybe 2 offhand that I can think of. Right. And I know a lot of research in colleges and researchers, and
Oh, yeah. Yeah. Matthew and I were having a conversation about reparations in medical care. And I think that is something that is really interesting to think about. And, to start nurturing that from a young age and early on, I think is one way where we can start to make those amends and make it so that communities of color do feel supported from the very beginning if they want to go into something like, research, and have more people be in the room.
Right.
So,
I agree with you. I feel like we're working against behind the 8 ball, and I'm going to speak to an Ivy League doctoral fellow program researchers, and It's like they have a new cultural competency sort of like module, and I'm part of module number 9. And I guess they really want to hear from the patient. And this is like, oh, they're inserting now. I've often thought about that. Like, you know, there are a lot of researchers who are doing the research, but they don't have access to patients, like behind the scenes. So things become sort of like a subject, like, when I look at my medical record, I was a subject. And so it's like, I'm a person. And I had needs and I wanted to stay alive. I wanted to go home to my family. And in order to do what I did, thank goodness I was on the trial that I was, and I got treated where I was at the time that I did. But again, I've heard from patients who have not had the same experience. And so it's important for researchers coming out of school, even the ones who are already established, but especially the ones who are coming out of school, to include cultural competency and what it takes, and to accrue more patients of color in clinical trials, and really think about bridging the gap in the African American community. And as a researcher, how can you do that? And understanding why there is skepticism, because a lot of them really don't understand.
Yeah, we talked a little bit about the skepticism. I gave some context with the Tuskegee experiment in our last webinar. And I know with a lot of my family in particular, that is the main reason why people do not want to be a part of anything that has to do with the medical community. It just is so scary because of that happening. So, like you said, having that cultural competent teaching and having a greater understanding on that side of things is super, relevant and important.
Yeah, not being afraid to have the conversation,
Right.
because it's awkward. Nobody wants that. They can, get past it. You don't want to, no, have the conversation, because again, it builds trust that you're acknowledging, like, I know things went south and we were wrong. And some things historically were, atrocities put upon, the African American community. And that's not something I want to be involved in. That's not something we're doing.
Right.
Talk about those safety measures, talk about the research you're doing and the value. Help us understand the value of your research. You know what I mean?
Mhm.
Okay, let me think about this. But if you're not trying to really engage with us and build the trust, then it's, again, the needle won't move.
Right, exactly. I'll read a couple of comments here in the chat and then go to another question that we have in the Q&A. So in the chat, Stephanie says, in my last job being a teacher, I aimed every single day to tell the kids of all colors that they are scientists already and that they can do it as their career. I love that. I love that. I think had my teacher told me something like that, I maybe would have gone into a different field, if I knew that I could do it. So it starts with you, and that's awesome. I love that.
Big ups to Stephanie, because she is putting in the minds of young children that the sky's the limit. And no matter where you are in your station in life, if you feel like that's something that you want to do, then you can do it. Yeah.
And Vivek says, I'm a project manager at Savvy, and I'd love to learn more about, I'd love to learn more about more ways to reach out to patients online. Where do we find people, especially people of color, in need of these opportunities?
I think you maybe want to talk about that. Like, I don't know if patients of color really know what Savvy actually does, and maybe, reaching out to the community, the different organizations. Like I said, there's Touch BBCA, Black Health Matters, BlackDoctors.org, Karen's Club, like all these different organizations. There's a couple, the Sisters Network. There's a whole lot of us out there, but just reaching out and really having conversations with, the staff about partnering in projects. What are they doing? And being really interested, because again, you have to build a relationship. When you're asking for something, you can't just go in and ask, hey, okay. Sometimes people want to really know that you're invested, and it's not just a 30-second soundbite just for Black History Month, that you really want to be invested in what we're doing and what we're trying to do to stay alive, to access quality healthcare. So really be intentional about the ask and talk about it and be honest about it is, I think, the best approach.
Absolutely. We have two more questions, and then after that, I don't think we'll have time for any more questions. So we will go with these last two. Firstly, from Christina, she asks, with work like yours, how do you keep going when things get tough?
I take a break. like I took a break in like December up until like January. I was out of the country. I have to take a break because I have to sort of like center myself and really figure out like moving forward, how am I best making sure that I'm serving the patients, because again, I am a patient. And even though I'm out there talking to researchers and I get my side hustle on as a public speaker, at the end of the day, the reason why I'm doing this is because of the patients. And there are patients that I have never met who are waiting to have a conversation, right, with an advocate, an advocate who's actually had clinical trial experience, an advocate who understands science and understands the moves you have to make in order to access healthcare. And so sometimes I just have to step away sometimes, but it's not for long. I just sort of like re-energize myself. I may meditate, I may do some yoga, I do some spa dates, I hang out with my family. And those things are really important to regenerate and then say, okay, and then again, I dive right in. So that's what I'm doing now for the next couple of weeks. I'll be really, really busy. And then I'll, take a little break and then I'll be back on it again. So it's just balancing the act and making sure that when I feel like I'm getting too tired or I feel like I'm running on fumes, to be self-aware enough to say, I'm not going to be of service to anyone if I'm too tired to be able to have a conversation or to really get in deep in regards to a conversation about what their needs are. So having enough self-awareness to go, okay, let me stop for a moment. Let me just pause and get some sleep and eat some good food and exercise. Yeah.
Yeah. It's the old adage of you can't pour from an empty cup, right? You got to take that time to refill and recharge and get re-energized and ready to go for the next sprint like you're in now.
Yeah, definitely.
Yes. And lastly, from Jen Horangev, shout out to Jen. She founded Savvy. Woohoo! Yeah, Jen, thank you so much for being here. She asked, when you enrolled in a clinical trial, how did friends and family react to this decision? Were they supportive or did they have concerns? If so, what did they say to you?
It's a very interesting question because I had made a vow to myself to make an informed decision. So there weren't a lot of my friends around who understood clinical research. They may have heard about clinical trials, but most of my friends and family, especially my sister and my best friend, I love them so much because they didn't allow me just to lay down. And I know that's probably like harsh, like, oh, but it's nothing wrong with being upset about something or sort of like insecure about something or sort of like, being sad about something. But every day I felt like they wanted to know what my plans are, and holding me accountable to the vow I made to myself to survive and not make any emotional decisions. Who did I talk to? What was the conversation about? What were the notes? What's your next move? What did they say? Where are you going on this visit? Do you need something faxed? They were very, very my son's auntie Ramona. There were a couple of people who were in my corner who were really, again, they did not know, the particulars about science, but they understood the moves that I was trying to make and why. And they were very supportive and very just there for me to run ideas by, because again, it was really about me running these ideas and really formulating that master plan. And so that was really, really important. So I would say the circle is very tight, but again, I made the vow to make an informed decision and they held me to that. And I appreciated it.
Yes, I love that. I love that. Lastly, I'll share my slides so that people can write down your social media and see where to find you. But if you wouldn't mind just saying it again so that people know where to find you.
www.karensclub.org, and I think it's Karen's Club NYC1 on Twitter. Like, you can find me. I'm out there. Or you got to Google the website, Karen's Club. It will pop up, and there's a way.
Yep, you'll find everything.
Yeah, it's there. All right. This was great. Yay.
Yes, thank you everyone so much for joining us. This was a really wonderful session, and I'm so grateful to you, Karen. Thank you for being here, and thank you for sharing your expertise, your story, your passion. It's been a really, really wonderful hour, so thank you so much.
You're welcome. Thank you, Savvy Co-op, for having me on. Thank you, Ariel, for being such a great host. I really appreciate it.
Of course, of course. Thank you all so much for coming, and we will see you at the next webinar. Next one will be happening on February 21st, and it'll be at 1 p.m. Eastern. What we'll be talking about is fostering community. So, as Karen said, you're going through all of these things, and the next step is how do you find people to be in your corner, and how do you find community if you might not be able to find that within your family. So, that is what we're going to be talking about next week with two reproductive health organizations. So it is going to be awesome. And I look forward to seeing you all next week.
Bye.
Thank you again and have a great rest of your evening.
Bye. Thank you.